Preventing music infections begins with hand washing. Step 1 of the 6-step method of hand washing. Place your palms together and rub them. Step 2. Place your palms together and rub them. Step 3. Place your palms together and rub with your fingers intertwined. Step 4. Place your fingers together and rub. Step 5. Rotate your thumb to the other palm and rub. Step 6. Place your fingers on the opposite palm and rub, making sure to clean under your nails. Prevention of infectious diseases. 1. Wash your hands properly. Korea Centers for Disease Control and Prevention.
Influenza vaccine, a medicine that is safer to use if you know it. As it gets colder, I need to get my family vaccinated against influenza. My father and I are in the boat, and the number of influenza 3 strains is 110.
Pregnant women are also eligible for vaccination. By the way, National Mingik is 4 months old. Do I need to be vaccinated? It is possible from 6 months old or older. For the first time in life, you will need to be vaccinated twice at 4-week intervals. After that, you will need to be vaccinated every year. Then, when is the right time?
Since the preventive effect appears approximately 2 weeks after vaccination, it is recommended to get vaccinated early before the epidemic season. In Korea, the virus is prevalent from winter to spring of the following year. Accordingly, it is recommended that inflation factor vaccination be started in October before the epidemic and completed by December at the latest. There are 2 types of injectable vaccines used in Korea, trivalent and tetravalent. Reactions such as fever may commonly occur after a preventative treatment, but these symptoms usually disappear within 2 to 3 days. It is safer to use medicine if you know it. Influenza vaccine is a preventive measure.
알고 쓰면 더 안전한 의약품 인플루엔자 백신 예방 접종과 함께해요.
Hello everyone, this is the Korea Centers for Disease Control and Prevention. From now on, we will learn about the mysterious abalone bones that cause infection. First, tuberculosis and tuberculosis bacteria enter the body. It is a disease caused by invasion. Energy chips are the most common symptom, and symptoms such as fever, weight loss, and fatigue may also occur. Tuberculosis is a representative respiratory infectious disease transmitted through the air, and patients with contagious tuberculosis are. Latent infection can spread tuberculosis bacteria to other people. Latent people are in a state in which the small number of tuberculosis bacteria that enter the body do not multiply and do not develop tuberculosis. There are no symptoms similar to tuberculosis, and blood bacteria are not discharged to the outside, so it is not contagious and cannot be spread to people around you. However, about 10 people with latent infection will develop tuberculosis during their lifetime. Latent resolution infection screening. Latent resolution infection screening can be performed on Mycobacterium tuberculosis infection. Cases with high risk of blood onset tuberculosis outbreak. See moderate tuberculosis outbreak. I in case group. It is necessary in cases where there is a high possibility of spreading tuberculosis when a facility worker develops tuberculosis, especially with contagious tuberculosis patients. In case of close contact, the risk of blood type infection is high and the risk of developing tuberculosis is high, so it is latent. Screening for tuberculosis infection is essential. Also, according to the method of failure, medical period is postpartum care center, school, kindergarten, young G. Workers and faculty at child welfare facilities, etc. must undergo resolution verification and a latent resolution alias examination. Treatment of abalone tuberculosis infection. Treatment of latent tuberculosis infection. 1 or 2 types of tuberculosis medicine for at least 3 months. It is administered by taking it once a day for up to 9 months. If you are taking any medications, inform your doctor and check your health status through examination and blood tests. You need to check the side effects of latent infection treatment and the treatment for latent infection. It has been used for a long time in temple treatment and is mostly safe. However, like other medicinal herbs, side effects may occur depending on the individual. Common headaches, dizziness, and gastrointestinal disorders. Mild side effects such as liver toxicity may occur, but serious side effects such as hepatotoxicity may occur in rare cases. If side effects occur during treatment, stop taking the medication and contact the Korea Centers for Disease Control and Prevention call center at 133 as soon as possible. Contact us for a period of treatment so that we can take appropriate action. The World Health Organization WHO. A group of people at high risk of developing tuberculosis are being arrested and undercover for screening and treatment. Treating a latent tuberculosis infection can reduce your risk of developing tuberculosis by 60 to 90% and passing it on to others. It can prevent the risk of rupturing the meridians. For more detailed inquiries, please refer to the relevant Gospel book. Please contact the Korea Centers for Disease Control and Prevention call center at 1339. Thank you.
Health authorities have requested vaccination and hand washing to prevent chickenpox, which is a common infection among children and adolescents in late fall. Chickenpox causes a mild fever and rash-like blisters all over the body for about a week to a week.
It occurs at a high rate in children aged 3 to 6. Patients with mumps symptoms experience swelling in the salivary glands under the ears and pain for about a week. Recently, measles cases have occurred in Gyeonggi-do and Daejeon. Concerns are growing because it is highly contagious. However, measles can be prevented with just one vaccination.
This is reporter Park Jung-hyeon. Measles, which is caused by RNA virus infection, is highly contagious. It is transmitted through coughing, sneezing, and saliva, and can especially be transmitted through the air. If you come in contact with a sick person, you will develop more than 90% of the disease. Just one measles vaccination is 93% effective. In accordance with the World Health Organization recommendation, Korea administers the vaccine twice per person. You only need to be vaccinated twice, once between 12 and 15 months of age and once between 4 and 6 years of age. However, if you are in an area with an epidemic, it is possible to not get vaccinated earlier than the due date. 2 vaccinations need to be administered about 4 weeks apart. Currently, in order to apply for child care for infants and hand, foot, and mouth disease, which occurs frequently in infants and toddlers, is showing signs of becoming an epidemic. Since there is no vaccine yet, prevention is said to be more important than anything else. Reporter Park Cheon-young introduces prevention methods. Hand, foot, and mouth disease, which is caused by the hand, foot, and mouth disease virus, causes fever and blisters on the hands, feet, and mouth, and occurs most often in children under the age of 5. It is a dangerous disease that can be accompanied by complications such as meningitis and encephalitis. According to the Ministry of Health and Welfare, the number of hand, foot, and mouth disease patients has steadily increased from 07 per 1,000 patients last month, tripling to 230 last week.
There is no vaccine for hand, foot, and mouth disease yet, and even if you have known it once, it can occur again, so prevention is more important than anything else.
You must wear hand utensils and cover your nose and mouth when coughing. Also, thoroughly disinfect toys and utensils from movies, and if hand, foot, and mouth disease is suspected, seek medical treatment and take accounting measures as there is a high risk of hepatitis.
If hand, foot, and mouth disease is suspected, avoid contact with others to prevent the spread, and do not send infants to daycare centers or kindergartens. What do you think travel is? A healing gift for me. It can't be delicious. Hold on. Then, how should I quarantine? I have to stamp my feet in an unfamiliar country. Take memories, take experiences, take new days, get a travel ticket. For the above trip to start again, take a customized travel quarantine list Korea Disease Control and Prevention Agency. That's right, you know that. They say you can prevent respiratory infectious diseases by just doing one thing well. Open windows and doors to allow for ventilation and use a fan. Ventilation is better. Ventilation devices allow as much outside air in as possible. Please turn it on. It will be effective if used together with an air purifier. Let's prevent respiratory infectious diseases together through wise ventilation. The surest way to prevent cervical cancer is... What is that?
그게 뭐죠?
HPV vaccination is the virus that causes cervical cancer. Widely eligible for free vaccination support. Female adolescents aged 12 to 17 and females aged 26 depending on income. The most surefire way to prevent cervical cancer is HPV vaccination.
예방접종.
Prevention of cervical cancer begins with vaccination. Sound effect. How much do you know about the different types of hepatitis? Hepatitis is inflammation of the liver due to causes such as viruses, alcohol, blood, and autoimmunity. It refers to the condition that occurs. The type of virus that causes hepatitis is. Accordingly, it can be divided into A-B-C hepatitis and fully recovers within 6 months. It can be divided into acute hepatitis and chronic hepatitis where inflammation lasts for more than 6 months. In the case of acute hepatitis, the symptoms are similar to cold symptoms in the early stages. Fever, loss of appetite, fatigue, muscle pain. There are symptoms of abdominal pain, and in severe cases, symptoms such as jaundice and dark brown urine may appear. Hepatitis B and C are mostly asymptomatic. If it progresses chronically, liver cirrhosis and liver cancer may occur, which in severe cases may lead to death. Most liver inflammation is caused by viruses entering the body. Hepatitis A and Hepatitis E are. Avoid food or water contaminated with viruses, such as meat, shellfish, and unheated meat products. Infection occurs when ingested and transmitted to others through hands contaminated with feces of an infected person. You can become infected even if you touch the skin or have poor personal hygiene, such as washing your hands. Most hepatitis B and C infections occur when exposed to the blood or body fluids of an infected person. Medicines derived from sexual contact or contaminated blood. Reuse of contaminated syringes, use of unsterilized needles, piercing. Infection can occur during the tattooing process, etc. In addition, infection can occur from an infected mother to her newborn, in which case the newborn may. It can progress to chronic hepatitis. Now, let's talk about hepatitis prevention tips and let's take a closer look at the treatment. Hepatitis A can be prevented through vaccination. Although it is preventable, hepatitis E is a common disease as there is no vaccine. Prevention is necessary. Common prevention methods for hepatitis A and E are: wash your hands with soap under running water for at least 30 seconds. Hygienic cooking. Prevention is possible through daily lifestyle habits such as eating safe foods. There is no cure for both hepatitis viruses, but sufficient rest, proper nutrition, and most recovery is possible through water intake. Like hepatitis A, hepatitis B can be prevented through vaccination. Treatment of acute hepatitis B is sufficient. Rest and high-protein diet are the main treatments. Chronic hepatitis B is treated using oral antiviral drugs. There is no vaccine for hepatitis C, so it is blood-borne and because infection through sexual contact is prevented in advance and there are many asymptomatic infections, it is important to proceed directly to treatment through regular checkups. Fortunately, there is a cure for hepatitis C and it can be completely cured with medication. Lastly, let's briefly summarize AEB hepatitis C virus. Most cases of hepatitis can be prevented by maintaining a clean, hygienic environment and getting vaccinated. For me and all of us, be sure to follow the hepatitis prevention rules. Recently, as the number of overseas travelers increases, mosquito-borne infectious diseases are also. What is an imported mosquito-borne infectious disease? It's an infectious disease that is transmitted into the country by being bitten by a mosquito abroad. You are infected with a mosquito-borne infectious disease. Main symptoms include fever, headache, and muscle pain. Depending on the type of infectious disease, rash and conjunctivitis may occur. To prevent mosquito-borne infectious diseases, before travel, check the current status of mosquito-borne infectious diseases in the country you are traveling to. Vaccinated or take preventive medication when necessary. Bring mosquito repellent, mosquito net, brightly colored long clothes, and medicine. While traveling, spray mosquito repellent and avoid places with many mosquitoes. When doing outdoor activities, wear light-colored long clothing. Do not use cosmetics or perfumes with strong scents. After the trip, if suspicious symptoms appear within 2 weeks, you must immediately visit a medical institution, inform them of your travel history, and receive treatment. Above all, the best prevention is not to be bitten by mosquitoes. Follow the precautions carefully and have a safe and healthy trip. Do you know that you can contract an infectious disease if you are bitten by a tick? Please follow 7 preventive rules to avoid being bitten by ticks when doing outdoor activities. When sitting on the grass, use a mat and wear brightly colored long clothes. Spray tick repellent and be sure to wash your clothes after returning home. Wash your body thoroughly with soap and look for signs of tick bites. If you are bitten by a tick or feel sick after outdoor activities, go to the hospital immediately and receive treatment. Keep yourself and your family healthy with 7 preventive rules. Korea Disease Control and Prevention Agency. In spring, infants and young children are susceptible to rotavirus. Rotavirus vaccine has been included in the national mandatory vaccination list, reducing the cost burden on parents. Policy interview. National reporter Kim Se-jin met with an official from the Korea Disease Control and Prevention Agency to find out more. Music.
저는 지금 질병관리청에 나와 있습니다. 지난 6일부터 시작된 로타바이러스 예방접종과 관련해 얘기 나눠볼 텐데요. 예방접종관리과 권근용 과장님과 얘기 나눠보겠습니다. 안녕하세요.
안녕하세요. 권근용입니다.
오늘은 이 로타바이러스 무료 접종에 관한 얘기를 나눠볼 텐데요. 무엇보다 영유아를 둔 이 부모님들이 굉장히 반길 것 같아요. 로타바이러스가 무엇인지부터 설명해 주시죠.
네, 로타바이러스는 영유아들의 주로 설사와 고열을 동반하는 그 RNA 바이러스입니다. 그래서 대부분의 이제 생후 5세 미만의
Music.
그런 감염병입니다.
겨울철은 물론이고 봄철에도 영유아에게 굉장히 많이 발생하는 질병이라고 들었는데요.
네.
예방 접종이 무료인 만큼 꼭 영유아가 이 로타바이러스 접종을 해야 되는 이유가 있을까요?
자녀가 태어나고 얼마 안 돼서 고열이나 설사를 갑자기 밤에 일으켜서 급하게
You may have had the experience of rushing to the emergency room, panicking, or suffering a lot. The most common cause is now rotavirus in infants and young children. These notavirus infections are known to occur in infants and young children. Dehydration can occur due to diarrhea, and since this may be necessary, the best preventive measure is. It can be said that vaccination is important, as rotavirus is now included in the national mandatory vaccination system. I am curious about what is different from before. Becoming a nationally required vaccination means that all. This means that the cost of vaccination will now be borne by the state and local governments. So, until now, parents are now required to pay for rotavirus vaccination for their infants and young children. So, I had to pay about 200,000 to 300,000 won on average, but now that it has become a national mandatory vaccination, it is free. Now that you can get vaccinated, is it possible to get free vaccination anywhere in the country? I'm curious. Is there a public health center or vaccination service anywhere in the country? Vaccinations are available at medical institutions, and there are about 3,000 vaccinations available across the country. There is a place, so you can get vaccinated anywhere near you. Eligible for vaccination. Those eligible for vaccination are 영유아s that are between 2 and 6 months old. So, there is a vaccine that takes 3 doses and there are 2 types of vaccines that take 2 doses. The 2-dose vaccine is administered at 2 months, 4 months, and the 3rd dose is administered at 2, 4, and 6 months of age. Even if the vaccination is delayed a little, it can be administered until 8 months of age. All vaccinations will be completed. I understand that the timing of vaccination is very important, but the manager explained it well. You gave it to me. Now, what types of vaccines are there and how they are administered? Please tell me. There is a vaccine called Rotavirus and a vaccine called Rotatech. The Rotavirus vaccine requires 2 doses, and the Rotatech vaccine requires 3 doses. Basically, when we use vaccination, we think of a vaccine administered through a needle. The rotavirus vaccine is a warning medication, so the liquid in the tube is now refluxed directly. This is the method of vaccination. Is there anything I need to be careful about when getting rotavirus vaccination? It is best to vaccinate your child when her overall condition or physical condition is good. You may feel fussy or have other difficulties, so follow the guidance of the medical staff. I hope you can trust us and leave it to us. And after vaccination, some people may experience fever or vomiting.
수 있습니다.
You can, but this part is mostly mild and gets better after a certain period of time.
괜찮아지기 때문에 크게 염려.
Don't worry too much, just get more shots.
끝으로 이 기존에 상당히 많은 비용을 내야 했었던
I think it is very important as such vaccination is now free in the zone. Lastly, please say something to our viewers. We are currently experiencing an unprecedented low birth rate, so what is the health of our children? This is an even more important time. For the health of our children, we must prevent rotavirus infection after 2 months of age. We ask you to make sure you get vaccinated. This policy will be of great help to parents of infants and toddlers. I hope so. Thank you for your words today.